I want to welcome you back to our final presentation of our 1972 class reunion. So thanks for just hanging in there for a great, wonderful, and enriching week of activity. It's hard to believe that we had in-person things last Thursday, and now we are finishing up with our virtual events tonight. So thank you, thank you, thank you. Just for our recording purposes, I'm going to introduce myself. My name is Jordan Langer. I serve as the Alumni Relations Officer for the School of Nursing. It's been a privilege and an honor to work with the class of 72 over the last 9 months of activity, believe it or not, bringing this reunion together. So tonight I'm super excited. We have several current nursing students, as well as our assistant director, our assistant dean of academic affairs, Katie Bleier, who's joining us to talk to us about our current curriculum, our clinical placement sort of process, and talking about student support resources that we offer within the School of Nursing and beyond. So the first part of our evening tonight, we are going to hear from Katie, and then we'll shift gears to talk to our students about their nursing experiences and what their hopes and aspirations are post-graduation. But before I hand it over to Katie, I do want to just recognize and do a quick land acknowledgement and remind you all that the land that UW-Madison and the School of Nursing sits upon is Native Ho-Chunk land. So we've incorporated that into all of our events and speaking engagements just to pay homage to the land that we are all secured on. So without further ado, Katie, I'll hand it over to you. I think I've given you privileges, so you should be able to share your screen, but if not, I'm happy to troubleshoot.
Okay. Thank you, Jordan. I am going to pull up my PowerPoint to make sure that I can do that. Let me share my screen. And then bring up my presentation. Jordan, can you see it?
I sure can. Looks great.
Jordan, can you see it?
Yes, can you hear me?
Yes.
Oh, yep, I can see your screen.
And can you see the PowerPoint?
Yep, I can.
Okay, wonderful. Thank you so much. So like Jordan said, my name is Katie Bleier. I serve as the Assistant Dean for Academic Affairs at the School of Nursing. And I've had the privilege of doing so since about 2019. I served in an interim role before taking on the position full-time right before we all went home for the pandemic. So I had a fun time learning a new position. Actually, it was a few new positions, right? It was a position of Assistant Dean for Academic Affairs, but I was also learning how to teach my 3 kids in my basement at the same time. So, so glad to be back amongst all of the students and the staff and the faculty in Cooper Hall again. It really is a special place, and I'm glad to be back there. I've worked on campus since 2008, and I am a Badger alum, although not of the School of Nursing. I graduated in the early 2000s from the university. So I'm going to tell you a little bit about my office, about academic affairs, and all of the things that we do. So what academic affairs works on primarily, academic technology. So making sure that students have access to all of the resources they need for classes. We use a learning platform called Canvas. So students log into their Canvas site for each course. They get to see the PowerPoint presentations or recorded lectures, take exams, view assignments, submit assignments, things like that. All of that work happens in our academic technology team. C10, the Center for Technology Enhanced Nursing. I'm sure you're all familiar with that space. It really is innovative and provides our students really a great opportunity to be in that simulation space before they make their way out into their clinicals. We have our Associate Dean, Lisa Bratsky, and myself in the office. We have advising and student services, admissions and recruitment, clinical placement, and our compliance office. And we also have a unit that works with student and curricular data and other kind of student-facing technologies. So a little bit more about our experiential education. So for the BSN students, whether it be in our traditional program or our accelerated program, students participate in a number of different experiences. So let me think if I can count all of them. So 1, 2, 3, 4. So 4, sometimes 5, actually, no, it's 5 different experiences. So they'll have 5 different rotations starting off in their first year. So that's the 316 class. And they are paired with one instructor. So it's 8 students with one instructor for the first semester. In the second semester, it's the same model, but there's 2 classes that happen right after each other in their second semester. So they do one 8-week rotation, and then they switch and do a different 8-week rotation. So it's a little bit quicker, and they get more of a variety of experiences there, but still working with an instructor. Then in their last year, they work most likely with preceptors. So one-on-one with nurses out in the community, out in our local hospitals. Students can actually travel up to 90 miles away from Madison in order to reach some of the places that we have our partnerships with. And so we have a pretty broad reach. We do also, in the senior year, have more specialized experiences for students with instructors. So that one is, there's one instructor to 4 students. And we try to match the faculty up with their area of expertise. So right now actually is when the time that we're working on making those arrangements for the spring term. And some of the things that we're looking at this year are some more psych mental health nursing sites, some labor and delivery sites, some more acute need areas within the hospital. So all over the place, our students get a lot of really interesting experience. And one thing that we're really proud of is that even when the university was remote during, kind of the height of the COVID pandemic, all of our students were able to still be out and with their clinical instructors or with their preceptors. They never skipped a beat. They finished all of their hours and were able to graduate. So it was a lot of work on everybody's part, including the students, but everybody did it, and we were really proud of that. We also have some global and local immersions. So it's a little bit like an immersion is, you can kind of picture it like a study abroad program. We haven't, unfortunately, been able to do the international programs over the last couple of summers, as you can probably guess why. But we generally alternate between going to Thailand and Malawi. We're hoping that this summer we can send students again internationally. We do have some local immersions as well, and 2 of which we ran this past summer were really great. We worked with the Easter Seals camp at the respite camp in the Wisconsin Dells. And we also formed a partnership with Girl Scouts of America and had students placed during Girl Scout camp this summer. And actually our clinical placement team won an award from the Girl Scouts organization for their innovative partnership, and they were nominated for an award through the United Way as well. So we're looking to really grow programs like that, and the students gave us really good feedback on their experiences as well. And we work to place our DNP students. We've got one dedicated clinical placement coordinator who works specifically with our graduate student populations. And we're working to place our students across really the whole state of Wisconsin. We've got students all over the state, sometimes even outside of the state, Illinois, Minnesota. We currently have a student in Nevada, or New Mexico, places like this. So we've got a broad reach, and we're working all over the place to get our students really meaningful experiential education. This is a little bit of our advising and student services team. You can see Darby Sugar. She's our Director of Advising and Student Services. Molly is one of our amazing advisors who works with our undergraduate students when it comes to questions about what classes to take leading up to the program. So all of the prerequisite courses, or perhaps students are thinking about taking courses for a certificate, which is what we call a minor, or an additional major, things like that. Lee just started with us, so unfortunately you can't see her picture, but she's working really closely with our BSN at home population. So the online program for ADN nurses to complete their BSN through a consortium of UW campuses. And Kelly Richards is our career development and learning support specialist. So she does all of our career advising. She works with our Nursing Learning Center, which provides one-on-one or group academic support, either in didactic or clinical courses. and also all of the NCLEX preparation. So they're actually going to start that up next month. I'm excited to say we recently had a new position approved as well within the Advising and Student Services team. It's Assistant Director for Student Success. So what that individual will be tasked with is really looking at our pre-nursing population. So those students who are working on getting into the program and making sure that they have the support needed to persist all the way to the application. We found over the years that we lose some students along the way, and we're curious why and what's behind that and what can we do to make sure we can help those students cross that finish line. So we're excited about that. We just wrapped up interviews today. So hoping to have that new team member soon. So different things that happen within advising and student services, obviously one-on-one academic advising. Students can come see advisors within Cooper Hall. We, through the pandemic have developed online appointments as well. We talked about clinical immersions. We help students run their student organizations, provide support there. Obviously a liaison to campus resources. I should mention, now that I'm just remembering now, the School of Nursing, just this year, just happened a couple days ago, hired what we call an embedded mental health provider. So this is a person who works centrally with our mental health services through University Health Services, but will sit and serve our nursing students specifically within Cooper Hall. So students don't have to necessarily go over to UHS to get appointments. They can be right here in Cooper Hall to get those. And what's really exciting is that the individual that they've hired has experience working with schools of nursing and really has a good understanding of, what it means to be a nursing student and some of the stressors that they might be facing more uniquely than other students on campus. So we're really excited about that. And this person also will help faculty to build in wellness opportunities and things like that into their curriculum. We also do mentor matches. And then I talked about our Nursing Learning Center, really to provide NCLEX preparation, academic support, and we do wellness activities too. So every month there's a new theme. We'll bring dogs on call one month. This month it's all about taste testing, and so we put out pieces of pumpkin pie and craisins and apple slices for students to come through and just grab a snack and take their minds off the classes even just for a minute. Career advising. So like I said, Kelly is our career advisor. She does one-on-one appointments. She works with students on their resumes and their cover letters, preparing for interviews. We do host 2 career fairs, one in the fall and one in the early spring semester. And she helps students also get prepared for nurse residency programs or potentially graduate school if they're thinking about going on after their BSN. So a little bit about the curriculum. So let's see, in 2017, the faculty, they finalized, but over many years of development, the concept-based curriculum. And the idea behind the concept-based curriculum is instead of maybe focusing on a specific disease like diabetes, you're looking at more like glucose regulation and how does that, yes, also affect diabetes, but other things as well, other systems and other conditions. So it's a little bit more higher level. What's interesting is although the work was wrapped up in 2017, we've had really great success rates with our students passing NCLEX. We were a little bit, worried with the start of a new curriculum. Oh, you might see a dip in the NCLEX pass rates. That definitely didn't happen. Students are doing really, really well, and we're pretty proud of that. This year, though, the AACN has kind of made a call out now for programs to reevaluate some of the pieces of the curriculum, and they're looking for us to make sure that through our concept-based curriculum, we're meeting all of the competencies that they've got in line. And so there was a group of faculty who worked really diligently over the summer to make sure that our courses and our learning objectives, all the way down to the objectives of certain assignments and like the artifacts that we show and demonstrate, yeah, our students are meeting these. They went through line by line and made sure that our curriculum is still in line with what the AACN has set forth. So a lot of hard work, but we're really glad to be where we're at. So you can see here some of the program outcomes: to promote health and manage illness, employ professional nursing leadership, make effective use of technology, understand the roles and scope of practice as an effective and collaborating member of an interprofessional team. That interprofessionalism is really imperative, and students several times throughout the academic year come together with medical students, pharmacy students, sometimes Master of Public Health students, PA, PT, come together in some interprofessional activities. Evidence-based care, identify health disparities and advocate for basic essential health services for all, allocate healthcare resources, and to assume a fiscal and ethical responsibility, and obviously to be a member of the nursing professional within the community and in our whole world. These are the things that we're committed to, and we're proud that when our students graduate, they're able to check these boxes. So that's what I have here. There's Bucky being real safe, washing his hands. He's got his mask on. But I'm curious if anybody has any questions.